Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
So my name's Colin. I'm 45 years of age. I live in Sileby. I was born in Sileby. I was brought up in Sileby. My wife was born in Sileby. She was brought up in Sileby. We've lived there all our lives. I've got 3 children. Aaron's 20, just come back from university for the Easter from Guildford, from the University of Surrey. Rowan is 18 and Shona is 15 in June, in a month or so's time. My wife Marion has previously been a carer in a school, and she recently gave up work. I'm an area director for a large bank, look after fairly large businesses, doing lots of lending and things like that. In my spare time, I'm a scout leader. I run the local scout group, going on camps and all things like that. I am also quite sporty generally. I like my golf, I like my tennis, I like walking. We've got 2 dogs. We walk them extensively through Charnwood Forest, 2 Cocker Spaniels who are very, very bouncy. And my wife gave up work recently because we've just started fostering. So we're now, well, for 9 months we looked after 2 or 3 girls, sisters, and we're just in between placements at the moment, but my wife's looking after a child on daycare basis this week. We're looking for our next placement to come through in the next few weeks, hopefully. So in 1999 I was self-referred into my GP, and in respect of a mole that I had on my leg, and that was eventually taken away and diagnosed as being malignant melanoma.
Colin, thanks for coming in today. Appreciate you spending this time with us. You're the first patient to come and talk to us about melanoma. So we really value what you have to say today. The first question I usually ask is about how your condition came to light. What were the early signs and symptoms?
Okay, so the first time it came to light was as a mole on my leg that had always been there as long as I can remember, right from a child, and it started changing colour, getting bigger, getting itchy, and even on occasions bleeding. My wife nagged me sent me off to the GP, and GP immediately referred me into Loughborough Hospital, which is our local hospital, and probably got that mole taken away within probably 2 or 3 weeks of first going to the GP under a sort of a local anaesthetic, a procedure that took probably no more than half an hour or something like that.
Yeah.
And they then sent that away, the sample away to be tested. The results came back, and they then realised that it was a melanoma. So they then had to take further skin samples to make sure they'd excised all the melanoma and got a good boundary around it.
Yeah.
And that was exactly the same sort of procedure as before. Very simple procedure, very easy, and no real recovery as far as I was concerned. It's just like having a blister or sort of just some wound or whatever that you put a plaster on.
So if people were worried about that, who are watching at that early stage, they can be reassured. It's usually quite straightforward to have that.
It's very straightforward, very quick, very like a minor surgery, the type of thing of like having a toenail or something like that taken away or whatever. No issues there at all.
Now they recalled you because they knew it was a melanoma and went into that more extensive procedure. But did you then start to look up information about melanoma? Were you given the information at the time?
So I had a consultant called Dr. Nicholson, who's a skin consultant, and he said to me, he said it's up to you, but I recommend that you don't look it up on the internet.
Interesting.
I did. And I understood why he recommended that you didn't look it up on the internet. There are so many things out there on the internet, especially American websites, that are just so confusing that it's very difficult to actually get to proper information, qualitative information that you can apply to yourself. And I within a month of having been diagnosed with that, I resolved that whatever happened next, I wouldn't go back onto the internet again and look it up, because there's all sorts of things. There's places where they start talking about percentage chance of survival and things like that.
Sure.
And you don't know enough to be able to put that in there. And actually, percentage chance isn't really relevant. It's it's me. It's my case. I'm one person. I'm not 100 people. So I'm not interested in that. That was the view that I took.
Yes, because your specialist clinician, your oncologist, will be able to tailor the expert knowledge for you, and basically give you a much more individualized discussion and information.
Absolutely, and a lot of the stuff in order to get the outputs, you've got to put information in that you don't really know anyway. And as I say, a lot of it is Americanized. That I found anyway at the time was that it wasn't relevant to what was happening over here in the UK and how we were treated.
So, what was your outlook at that stage, having looked it up, got a bit of a surprise or shock, and then kind of returned to the clinic maybe to discuss it a bit more?
So my outlook on that was sort of, right, okay, well, you've taken that mole away now. You've the response on the tests was there was a good margin around that mole, and I wasn't actually into oncology at the time. I was kept in the skin clinic, and they were just sort of like, right, no problem. We'll just keep you under observation, see what happens. But you need to check your own body and keep checking. And made sure that I could refer myself back in. They were very good about making sure that I'd got contact details, so that I could refer myself back in at any moment if I wanted to. Now,
skin cancer is interesting in a way because it generally is visible if it's on the surface. So there is the option for you to do a self-monitoring type of role where you're keeping a close eye on it. But I know what a lot of other patients say, which is that can cause them quite a lot of anxiety, some of the time anyway. In other words, you can be preoccupied by checking it sometimes. How do you find that balance between thinking about it too much and always looking to see what's happening. And
so nowadays I don't look on my skin because I think the way things have developed. I'm not a moly person, so it's not hard. Dr. Nicholson first off suggested just checking around in the shower once a week or whatever. If you check every day, then you won't spot the differences. Yeah. So you've got to have a regime about it, that if you're going to do it, that says, I'm going to leave it for so long, because otherwise you won't spot the differences if you look at it every day.
Yeah, I can see that logic.
And that sort of that logic that Dr. Nicholson put across appealed to me, and resonated with me. So that was fine. But it wasn't just about the skin. It was about checking lymph nodes and what have you, and that was the important thing as far as I was concerned in the end. Yeah, that's a good point, because people are worried about the spread, aren't they, to other areas and involvement of other organs, for example. Yeah. So talk us through what happened in your case later. So 12 months later, I felt a lump in my groin and thought, don't remember feeling that before. Kept an eye on it for a week. It grew a little bit, or it became more noticeable. So I referred myself back in to my skin consultant, got an appointment within days, went back in, and what did they do? They got a very big needle injection and took a sample of the, I don't know what the name of the procedure is, but they took a sample of the lymph node biopsy type out, which was done. I don't think I had any. I don't think there was any need for any anaesthetic at all. It didn't hurt anyway. Took that away. That came back that the melanoma had spread into my lymph nodes in my groin. So I then needed a fairly major operation where they took away all the lymph nodes from my groin to take away the melanoma that was there, but also to examine to see how far that had spread. And going through that was going through various scanning processes. I was probably scanned 3 or 4 times during that process, both before and afterwards, to see whether they got all of the cancer that was there. I heard you say there about the need for further surgery, and it sounds quite extensive, that procedure. What do you remember about it? I know it's some time ago now. So I remember sort of coming out from having had the surgery, having had all the scans, having done all the pre-op work and what have you, and basically not being able to stand up. Yeah. Because it took away all of the ability to move in my leg. Sure. And took away all the feeling. So I remember not being able to stand, and actually trying to stand at one stage in the middle of the night and not being able to, nearly falling over. The subsequent sort of recovery and what have you was very quite lengthy for me this time, at that time. The first stage was really trying to get, I'd got various drains in my leg to help the lymph fluid circulate or come out of my leg. Getting rid of those was a big priority for me. And I seem to remember I went in for surgery just before Christmas, and I seem to remember getting rid of those just before Christmas. So that was a big milestone. And then I was probably 2 or 3 months off work while I got some use back in my legs, and I built up the ability to actually sort of walk around and what have you. I've never got the feeling back in the skin of my leg, so I'm completely numb from sort of just below the knee all the way up to the top of my thigh, because of the nerve damage that was done in getting rid of those lymph nodes. There was some thought that it might come back, but it didn't. Does that cause you any problems at all? Generally not. You just have to be aware of it when you're leaning against something very hot or very cold. That's about it really. So yeah, no, that's fine. But then subsequent to that, I've then been, sort of getting to know about the treatment for lymphedema.
Yeah.
Which is a sort of side effect of having all your lymph nodes removed, which means that my leg swells up, or can at different times with different results and what have you.
What do you notice? Is there a pattern to that?
No, well, there used to be. When I first had the operation, my leg was swelled up. I then had stocking that I needed to wear and various other types of hosiery and what have you. And then after about 2 or 3 years, the swelling started to go down, and I just couldn't be bothered to wear the stockings anymore. So I didn't wear them. I was sort of like, I don't need this, and sort of I considered it was sort of almost getting back to normal. So after I was discharged, sort of after about 5 years, and didn't have any more sort of contact with the skin people. It might actually have been 7 years. I think he kept me a bit longer than he should have done. Mm-hmm. And that sort of ended that cycle. I sort of ended that bit with a leg that was, apart from being a bit numb, was perfectly normal. A massive great scar, and sort of not much else. A feeling that was finished with. They'd taken the cancer away, and I was sort of 5 years, 7 years afterwards, and still clear.
So did you still have the lymphedema problem periodically, or was that sorted by then?
It was worse than the other leg, but it was manageable, and you'd notice it when it was hot, or when I'd been on my leg a lot or whatever. But I didn't need to wear any hosiery at that time. Did
you have exercises to reduce the swelling at all, or see a physio?
Not really. No, I didn't do any of that. I wasn't offered it. It was just stay active, and obviously doing the walking, doing some cycling, walking the dogs, all that sort of thing was just sort of normal. But then the trigger for the next episode was that my leg started swelling up again.
Right, so quite significantly this time.
Yeah, so I noticed that my leg was getting worse.
Yeah, what year was that?
So that would be sort of 2009, early 2010, and it was just gradually getting worse. And I didn't think any more of it at the time. I just thought, oh, this is annoying, it's come back. Oh dear, never mind. Maybe I'd better refer myself so I could get some more stockings to manage it again. So referred myself to my GP, who referred me to Loros, which is where you go for your lymphedema treatment, I think, in this area. And they sort of said, yeah, we'll look after it, but we think you ought to get referred back into the hospital, just to make absolutely sure that there's nothing else going on. Went back into the hospital, had another scan, and unfortunately the cancer had come back into a different set of lymph nodes that was sort of, I think we talked earlier, near to the femoral artery, so sort of right in the sort of stomach area.
Yeah. Does that actually tell you where the origin of the cancer was on that occasion, or was that just a secondary spread of another area? Do you see what I mean? Was that the primary site? The primary site originally was the mole on my leg, and then it spread. And then I think what's happening is that it effectively has spread up the lymph system. Gradually. So it spreads up the lymph system. So it couldn't go any more in the groin because there was no more lymph nodes there. So it was moving through the lymph system. And that was actually 10 years after your original diagnosis? Absolutely. Yeah. So I went back in for another operation, loads more scans, a lot easier operation this time in terms, for me, albeit it was very scary afterwards to find that I'd had a urologist, an oncologist, and one of the main and I don't know the name of this one, but the one that looks after the blood cells and the arteries and what have you. Yeah, hematologist. Yeah, don't think it was called that, but who basically whenever they go close to big arteries gets involved, and all three of them were in the operating theatre at the same time. Vascular surgeon. That's the one. Yeah. Yeah.
So I had a major, I think they put a call out to somebody during the operation to get them over from Glenfield because it got quite close to that. So afterwards, hearing that was very, very scary.
So you really went through a major procedure there, and you know, all those experts had to pull you through.
Yeah.
What was probably a very dramatic presentation at that time.
But the impact on me was very minimal.
I was about to say, you probably didn't know about it at the time, but when you woke up, you found out about it.
Yeah, and actually my recovery was a lot easier and a lot quicker than on the first one.
Yeah.
Because it didn't affect so many muscles.
Interesting, yeah.
So you know, so my recollection is that the first operation was a lot more traumatic. And the second one less so. Now that might be because I was used to it, but I think there was I think from a medical perspective, I recovered a lot quicker.
So that was 2009.
10, yeah.
10.
Yeah.
And then did you have to have any further procedures after that?
So no, I then had, obviously I was then seriously got the lymphedema because I've sort of got very few lymph nodes now left on that side of my body. They've sort of taken quite a lot of them away, so my leg does swell up quite a lot. So I go back every 9 months to Loros for the checkups on that, which is very comforting because they can then keep a quantitative size of my leg, so they know whether it's swelling up or not. Even though whether I feel it might be or not, they can tell me no, it is smaller now or it is bigger. So they can actually refer that back in. So I wherever I can, I try and time those appointments for just before I go in for a further follow-up consultant with my oncologist.
How do they measure that?
So they've got just tape measures.
Yeah, just a tape measure.
So they just measure the circumference.
So you could do it yourself if you were systematic.
Yeah, they're very systematic though, and they do it exactly the same each time, and they know exactly how they're doing it, and then they've got a system that works out the volume of your leg compared to its other one. I did actually have a secondary problem which was nothing to do with the cancer, which was that because I'd had so many operations down here, I ended up with a problem where my bowel had come out through my groin.
A hernia, effectively.
A hernia, but it was a weird one, and I ended up having to have another operation to solve that.
Was it causing a problem with the flow in the bowel, a strangulation?
No, it luckily not, but it was
still quite a serious complication.
It was interesting. And for a while I thought, because it caused a lump, I thought I thought that the cancer had come back.
Yeah, that's understandable.
Whether this is relevant or not, I don't know. So, but I forgot to mention that after the reason that the surgery last time I felt was quite minimal was also because at the time, about a month afterwards, I developed a blood clot on my lung, which then had to be treated. And for about 6 weeks, there was a lot of toing and froing between different departments in Royal Infirmary, Glenfield Hospital, as to whether the blood clot was a blood clot or whether it was the cancer having spread to my lungs. And that was exceptionally difficult period of time. We'd got a consultant at Glenfield who was telling me that my cancer had spread to my lungs. And I got a consultant in the Royal who was saying, no, we don't think it has. And they were scanning me quite regularly at that point to try and work out whether the drug treatment that I was having was having an impact. Luckily, it was a blood clot. Which I don't think many people will say that. But luckily it was a blood clot. We treated it with blood thinning drugs, and that got over that side of things.
That's quite a further kind of episode, a complication.
Sorry,
But
so nothing to do with the cancer.
It kind of turned out okay, even though you had to have further treatment for the blood clot. So do you remember what medication they were thinking it might have been due to? Was it a chemotherapy drug or?
So I've never had any chemotherapy, radiotherapy. So whether this is right or not, I don't know. But I was told on the first episode that Radiotherapy doesn't work with melanoma, or doesn't work with my type of melanoma, because we believe it was caused by the sun's rays, and that effectively is what radiotherapy is. So it's not going to have any impact, and apparently chemotherapy has very little impact as well. So there was no further treatment. The explanation to me was that because they'd taken the cancer away, there's nothing for the chemotherapy to work on. And therefore there's no reason for doing it.
I understand, yeah.
And that there's only really reason to do that where they suspect that the cancer is still there, and they didn't believe that. So, you know, each time they've operated, taken it away, and there's no further treatment because there's no need to. Whether that's the same with everybody, I don't know, but I you know, that's my type of cancer.
Do you feel reasonably confident that you can still carry on, you know, live your life without the prospect of that treatment in the background that some people with different conditions get? In other words, is it slightly anxiety provoking to not have a active treatment in the background?
I think definitely. I put myself forward for some trials where they were trialling some drugs, I think, that they'd used on prostate cancer, on melanoma cancer. And they wouldn't let me enter that trial because of the stages that I'd been through. They didn't feel it would give the trial a fair outcome, as it were, or I was a good base subject. I really did want some treatment, but I understand that there isn't any, so it's just a case of working with that. But it would feel as though people were doing more if you got some treatment, and that does add to the anxiety. A lot of people struggle with their diagnosis, not just at their initial period when they're diagnosed, of course, but everything that comes after that. I wonder how you've coped, because you've had quite a few stages and issues, so the surgeries, you know, the setbacks in a way, and complications, the lymphedema, for example, that you've had to manage. How have you coped emotionally with all of this? So the major point of stress, as far as I was concerned, was immediately after the first episode surgery back in 2000, and I was waiting for results to come back. I was absolutely desperate for the results to come back to find out whether the cancer had spread anywhere else, how far it had spread in the lymph nodes, what the position was, and therefore what the prognosis was. And being in hospital on your own at that time, there was nobody else to share it with. And that was very difficult. It was very difficult to actually get through that, and you know, spent a lot of sleepless nights, not just because of the pain and what have you, but also, you know, sort of waiting for people to come and tell you what the position was, and that was quite stressful. I sort of resorted to music and stuff like that, and tried to find some songs that meant something to me. Something a distraction, but in a meaningful way. Yeah, absolutely. And then the other stressful point was when they thought that the cancer had spread to my lungs. That was difficult on me and my family more, because I could share that with them. So we tried to keep that from our children, but they knew that something was the matter.
How old were they at the time?
So they would have been, so this is the second episode, so they would have been sort of 10, 15, something like that. So they knew that things were happening then, and they knew that we weren't happy. And my wife was very, very stressed at that time, and still looks back on that time very, very angrily and you know, with great emotion, because we really didn't know what was happening. So it's the lack of knowledge that causes the stress, but equally these results, they take 2, 3, 4, 5 days to come through, often longer than that, and you don't really know when you're going to hear from somebody or how you're going to hear from somebody, and you've just got to sort of take it and just accept that that's what's going to happen. I think the results from scans now are a point of pressure for me. So I had a scan in the middle of February, and my appointment to follow up on that was not till the middle of March. So you've got a month of waiting. Now somebody knows what the results are.
Yeah, quite likely, yeah.
And my track record, my history, I know that if there is something bad, generally they will call you back in quicker. but you don't know that for sure.
Yeah,
so you still play with that in your mind and what have you. And you know, I personally get over that by not sharing it, because I don't want to share my anxiety with other people. I try and bottle it up and keep it within.
I see.
But other people will deal with it differently.
I heard what you said about being on the ward and feeling relatively on your own with that. That strikes me as something that we should be looking to improve for future patients. And was it the case that you didn't have enough contact from other patients there, or family members who were coming in, or from the medical staff? What would have helped in that situation?
So I appreciate this was 15 years ago, so things may have changed in the meantime. But I was on a general ward. There was no specialist cancer care as far as that was concerned. So as far as the outside world was concerned, I'd had an operation. I hadn't had an operation relating to cancer. So I was on a ward with people who'd had operations to do with their kidney and their livers and things like that.
Yeah.
And therefore everybody was just treated the same. You're recovering. So, you know, potentially some acknowledgement of the fact that you've done that, but equally that might not be right for some people, because some people try and forget about the fact that they're actually there for cancer. And you know, that might have been, you know, that might have been the way that I tried to get over it the second time round, is that, you know, I was just in for an operation.
Yes, you can kind of tell yourself that.
You can get through both ways.
It's a kind of denial strategy in a way, a minimization strategy. Try and think about other healthy things as much as possible.
Absolutely.
Do you think it would have helped though to have other patients who you met at the time? Would it have helped?
I think anything that you can share experiences with people can help, so long as they're positive experiences. Then that can help. I'm not a great one for sharing, I must admit, but I'm sure. I suppose at that time as well, that's 15 years ago. I was 30. I was very, very young compared to everybody else in that ward. They were all probably 60, 70, 80-year-olds that were in the ward at the time.
Yeah.
There was nobody I could really relate to.
Okay.
And that was quite a challenge.
Subsequently, did you ever find out, given you did look on the internet and things for information in the early stages, did you ever find out any useful resources that would have brought that missing component up to date? In other words, peer support groups, chat rooms, anything like that would have been useful? Or weren't you really looking for that of late?
I don't really look for it. I've lived by the thing that I said earlier, that I don't go on the internet looking for it, for that. And I try to do that with anything else that anything else that happens. In terms of my family and what have you, I might look up to see what a term means, but I ain't going to dig any deeper, because you can find some really scary things that actually aren't relevant. And that's the thing that I've learned. And I think, you know, that's something that's really relevant. I've looked up Lymphedema Society in the past, and that's quite helpful to actually see different ways of dealing with the lymphedema, but that's not cancer related. And as far as I'm concerned, I don't have cancer. I've had cancer.
I see.
I don't have it. There's nothing I can do to stop myself getting it again. I probably will, I don't know, but there's nothing I can do apart from keep out the sun and all of the sort of relevant melanoma type related things, which I would do anyway because of my colouring. That there's nothing I can do to stop that. So as far as I'm concerned, you've just got to work with what you've got.
So this is a very interesting and healthy balance that you maintain. You're saying, I've been through it, it's in the past, and I'm okay in a way. But yet you're prepared, if you do need to be, for a future eventuality. So you must be quite a strong person to be prepared for it mentally and not let it unduly worry you on a day-to-day basis.
There's a case of it being all-consuming, and there's a case of just forgetting about it. And I think it's a case of trying to forget about it.
Yeah, you find that more helpful.
Yeah, I think
in your case.
Yeah, I think if I thought about it every day consciously,
yeah,
then it would eat you up. So you try to sort of block it out, concentrate on the here and now, concentrate on the good things that are happening, concentrate on the next holiday, the dogs, the kids, and everything else that's going on, and not let it consume you.
Yeah.
You know, I had a really, you know, going back 15 years, I had a really good career, which wallowed for probably 3 or 4 years because I didn't have confidence in myself and in my longevity. Following the second episode, I let it wallow again for another 2 or 3 years because I didn't have the longevity, or I didn't think I'd got the longevity. And you make decisions at different times, and I'm never too sure whether I make those decisions right or wrong. But you know, I made decisions to hire a car, to take a car contract out for 4 years, thinking I might not see this contract out. But actually looked into it and found out that was fine because there wasn't any penalties on my wife for getting out of it. And there's lots of things that you look into. You might not, you know, I'll look into those as and when they raise themselves, and think, right, is this relevant? How long have I got? You know, you start thinking about pensions. There's lots of talk about pensions at the moment. I try to avoid thinking about pensions because I'm not sure that I'll be around to claim one. But then I think, but then what if I do? If I've not thought about it, then I've got a problem. So there starts being lots of sort of contrary things going on in your mind at different times. So often it's better not to try and think about them.
Interesting, yeah, I can see that. Can we talk a bit about how families cope? You mentioned earlier about the children, and initially you kind of protected them a little bit, but they found out in the end anyway what was going on. But also your partner, how much is your wife involved and has been involved in all of these steps?
So my wife is a very emotional person. She's very different to me from that perspective, but it's surprising how strong she can be when she's trying to protect the kids and me and look after us. So that's been hugely helpful. I think we try and protect each other to a certain extent, and that can sometimes be difficult. But she nags me, she makes sure I do what I'm supposed to do, she makes sure I refer myself in, and that, you know, that's something that as fellas aren't very good at, is going to the doctor, and so she's very good at nagging. But equally then, you know, sort of we try and keep the kids as informed as possible now. The first time round they were too young. They were toddlers. Some, you know, my daughter would have been only just born, and you know, there was a lot going on there. So we tried to keep it from all the others. The second time around, that they were sort of 10 onwards, and it was much easier to try and explain things, but we explain them simply. I don't know whether but we might not have used the C word to start with. I think they realised that fairly quickly afterwards, but we talked about melanoma, we talked about lymph nodes, we talked about lymphedema. We probably didn't use the C word very much. Yeah. And we probably still don't. Because of what I was saying earlier, you know, we're all of the opinion that it might come back, but it's not there at the moment. So let's get on with it.
So in a way, you've come up with a healthy strategy together as a family, in a way. Yeah.
And you know, everybody knows what's there and what's that happening, and we are actually, it's helped us a lot with our, you know, as a strength, as a bonding as a unit, which we found very helpful with the fostering side of things that we've looked after, where we we talk a lot about what's going on. We had some very difficult times with our fostering over the last 9 months. The children have been very challenging. Our children have been very supportive, and we've been able to work together, and that's, you know, that's as a result of the episodes that we've had previously, and the way in which we managed to talk to each other about things.
I see. So you've been fostering then just for a recent period, 9 months altogether?
Yeah, so we started in June last year, so that was about 9 months ago. And we had 3 children for 3 or 4 months, and 2 children for a bit longer than that, nearly 7 months. Very challenging, very bad backgrounds. And
did you know what you were getting into at that stage?
No. we were approved at fostering for 1 child, and the first phone call that we had said, "Oh, we've got 3 children. Would you look after them?" So that was quite interesting point to go through. I mean, the cancer side of things came up during our approval for fostering.
They asked about it.
Well, we went to a fostering session. And they said something about, oh, we'll do health checks and we'll touch your doctor, and we asked a question about, well, this is my background, is that a problem? And they said, oh yeah, you won't be able to do it. And we were sort of like, what? And they were at that meeting, they were absolutely categoric that we wouldn't be allowed to foster because I'd had cancer. Because of the emotional impact that might have on our foster children if it came back.
I see.
So we had to have a lot of correspondence going backwards and forwards between consultants and them to prove that A, we could cope with it, how we'd cope with it previously with our own children, and also what my current state of play was. And that's relevant at the moment because we're just about to go through our 12-month review. And they're asking all those questions again, which I can answer because I've just had a clear scan. So I can say, yeah, I've had a clear scan. You know, therefore that's where I'm at the moment.
Yeah. I'd like to ask you a specific question, which is to have a think about new patients now coming through the system. I appreciate the medical system may have changed, innovations have happened, you know, but what I'm really thinking in general terms, given your experience over all these years, what would you say to a new patient who's just starting their cancer journey with a melanoma? Is there anything that you would want to feed back to them?
I think the main thing would be to be very aware of your own body, very aware of changes in that body and be vigilant about them, and not be afraid to go and discuss them with the specialists. You know, self-refer. You've got to, the sooner you can do that, the better. If you feel that there's something wrong. And my experience is that you'll never be looked at or laughed at for doing that, and that people will always take you very seriously. And that really is very important. I suppose the other things is I just take on board what Dr. Nicholson has told me about the internet, which is don't look at it. You know, that there might be some websites out there that help with web chat, with chat rooms and things like that. But if you start looking for information, it's not relevant to you. And if you look at it on the internet, what you need to do, the information you've got to get is from your consultant.
In a way, you're looking for good quality filtered material that can be personalised to you. There are useful sites out there, but it's best to be directed to them rather than coming across sometimes invalid material out there.
And there's a lot of it, and that really surprised me. How many websites there are out there that are just totally irrelevant, and you've just got to ignore them and wait for somebody to tell you where to go for that information. I think the family thing as well that we talked about, you've got to be very strong and find ways that you can cope. Whatever it might be. Everybody's got coping mechanisms, but you've just got to find your own way of doing that.
Using resources that are around to the best you can, and coping as a unit if you can.
If you've got the benefit of a unit, then talk and speak and communicate and try and build strength off of each other. everybody's stronger together. If you haven't got that, then try and find some people that you can communicate with and find that strength with.
And just out of interest, you mentioned the children, you know, going back to what you said about whether to tell them or not. What's your reflection now about whether to tell the children who are growing up about what's going on?
I think you tell them as much as they can understand. I think is how I would assess it. In the first instance, our children wouldn't have understood it. They were 4, 5, 1 year old. They didn't understand what was happening.
Yeah.
When they were older, they understood more.
Yeah.
But again, you've got to be very factual and make sure that they do understand what you're talking about.
Yeah.
So if you start floating terms around that they can't understand, then they'll worry about it. So you've got to make sure that they can understand and they're capable. If you start floating things in front of them that they're beyond their ken, then they'll panic about it. Yes. So you've got to understand that side of things.
That's good advice. Thanks. One thing I'm interested in, and other people will be too, is about how you maintain your role at work through this. Obviously, there's lots of ups and downs along the way, but it can affect you emotionally or psychologically as well. So I think, if I understand correctly, you've tried to carry on with your work role throughout. Is that right? Yeah,
I think, you know, not just carry on. I've developed my career.
Yes.
So when I was first diagnosed, I was you know, sort of 12, 18 months into being a manager for the first time and looking after my own clients, bank clients and what have you. And then during the 10 years in between those two episodes, I became more senior, got promoted. The only time I had off was when I was recovering from the operation, which was 3 months. The employer was very supportive during that time.
That's good.
Went back, got promoted. Was actually seeking the next promotion to be an area director just before the second episode and the second operation. I actually had to withdraw my application, having done the interview, to get that. And then since then, I've since gone back into that career pot and I've become an area director.
Yeah.
So I'm now looking after a patch, a county on behalf of the bank for commercial clients. So I've maintained my job, but I've also, you know, sort of maintained a fairly positive outlook. There have been ups and downs in terms of, you know, sort of taking a couple of years out to think, actually, do I really want the stresses and strains of trying to go for this?
Yes,
when I'm trying to recover and trying to come to terms with this.
Yeah.
And I think that was the positive from that was that everybody that I've spoken to in the bank, my mentors, my senior managers, my line managers and further up, have all been very, very supportive in terms of, you know, sort of, we're very happy with what you're doing. If you want to carry on doing that, carry on doing that. If you want to go for promotion, brilliant, go for promotion. It's up to you, it's your choice. We think you've got the talent to be able to do it. You decide when you're ready.
But on the other hand, you are still trying to do other things outside of work. So you've got to try and find the right work-life balance.
Everything's work-life balance. and you know, my perspective on that, I've been on various development courses and what have you. My perspective is that the cancer's helped me with that. Because you know, I can go back to these guys and I've got a completely different experience to all of my peers, and that cancer just gives you a completely different perspective.
Interesting.
And I just, it's not that you don't care, but you've got different things that are important to you. I'm not going to work. I'm going to work hard when I enjoy it, but I'm not going to work hard and long hours to the detriment of my health, of my kids, my relationships, because I don't know how long I'll have with them.
Sure.
So I'll work hard during the time to make the best of what I've got now, and to make the best of me, and that's what's important to me.
Has your illness held you back in any way in life?
Yes, but it's more psychological than anything. So I think I could have been more active than I have been. So I'm just taking up tennis again now, having not played tennis for 15 years, and it's killing me. But especially as I'm playing against my brother, and therefore the competitive streak gets into everybody. But I think I could have been playing tennis all the way through.
Yeah.
There was no need to not take part. I was trying to restrict the time I was on my leg because of the lymphedema side of things.
Although staying active is a recommendation, isn't it?
Yes, so I've swum. So swimming became my activity of choice, which is great, and it tones the body. It's absolutely great activity, and it's perfect for lymphedema because you've got no pressure on the leg. It's absolutely perfect. But I found that it's probably not as active as I would want. I can't swim as quickly as I need to get the anaerobic exercise that I probably need to, and therefore I'm trying to get some more of that sort of, you know, get out of breath exercise that I need to have.
But you're working on your targets again in a way, for your exercise targets, and you're trying to work on your tennis game and skills and that kind of thing. So you've got a good strategy here to improve. Yeah,
well, weight's very important. Especially with the lymphedema side of things, it's very important to keep that under control. And I've let that slip in the years up to probably up to last year. So my weight fluctuates by about 3 or 4 stone. And I'm currently on a downward trend again. So I need to get a little bit more stable on that side of things. So I've got some targets there, but sometimes things take other priorities.
Yeah.
So,
what are your plans for the future in general at the moment?
To do a good job at the moment, to develop. I don't know whether I want my career to go any further, but I want to take that to as far as I can. I'm trying to get my scouting into perspective at the moment to make sure I'm using the right amount of time on that, but still enjoy it. We're trying to get our fostering side of things sorted, and try and take as many holidays as I possibly can within the scope of all of that. And try, you know, there's a promise I made myself, which was to try and get away at every school holiday. I don't need to wait for school holidays anymore. So I've got a goal at the moment. I want to go on a river cruise when by the time we've been married 25 years, which is in a couple of years' time. There's various other goals that I've got that I want to try and do. I don't necessarily have a bucket list, but I think it is probably akin to a bucket list. And there are things there that I want to do and I want to see. And you know, it's about getting those things over the line, doing those achievements and seeing them done.
Are you still feeling positive about the future?
I'm feeling, it depends how far forward you're talking.
Exactly.
If you're talking the next 5 years, I'm feeling very positive about that. I probably, when I first started out as a career and as a person, and I set 10-year life goals. I probably set 3 to 5 year life goals now, and I think that's more relevant to the situation that I'm in. I personally don't think that I could set any longer term goals than that. So you might take that as being fairly negative, because I don't look further field than that, but I have little confidence about that.
Well, your horizon has shifted a little bit, but you're living within that and comfortably within it, so that it's not oppressive to you. You're still able to be, looking forward, but within the time frame that you think is realistic.
And I think that's quite important, is that those time frames will change. You know, during a cancer episode, those time frames might come down to months. But then you've got to try and expand them again as quickly as you can, as soon as you feel able to. If that's possible.
If it goes well,
so it's very, and that I think that's the hard bit, is that if things do go well, is trying to expand those horizons. But you set those goals within that time period, whatever you feel comfortable with. So it might be 2 or 3 months to get back on your feet again.
Well, Colin, thanks for coming in today and sharing your story with us and the viewers at home. I think that's a really fascinating story of living with a skin condition, a melanoma, which is perhaps more involved than I anticipated, you know, given the various setbacks and given the complications. But the key message I'm taking from it is you've, as a family really, learned how to cope with it. You've come up with a kind of survival strategy which, you know, yes, your view is different, but you're managing within that. You are really staying positive, staying active, still looking forward to the future, still progressing your career. You know, looking at you today, it's mostly positives that I'm seeing. So
Yeah,
that's
absolutely.
a great message to share with any viewer.
Yeah.
So thanks for coming in and
Thank you.
all the best.
All right. Thanks
Take
a lot.
care.